I'm part of Epic, PSA / Aviana. We recently merged back in February, so now we are one company together working to help these kiddos out in the greater Austin area and across the state of Texas. So I want to talk with everybody today about the different lines of business that you can find out in the community for children with special needs. It's always parent and patient driven. You always have your own choice of who you use. So if anyone says, hey, you should use this, you don't have to. There's multiple companies for everybody, for every line of business. It's up to you guys on who the best fit is. So I don't want anybody to think that, since I appreciate you guys letting us host it tonight, if we're not the fit, then we'll help you find somebody who is, because we just want to make sure you guys are taken care of for whatever you guys are looking for. So I'm going to try to ask questions. I got stuff to give away too, because everybody likes to listen to me when I have stuff to give away. It's more fun to raise your hand and talk a little bit instead of just listening to someone. So it might not be as interesting, sorry, but I'll kind of take you guys through the gambit of how it works, from what we call, as we call it from our side, referral, all the way to start of care or first treat, whatever you prefer. So we'll start small and kind of work our way up with the enteral nutrition side, and the what they call DME. A lot of times stands for durable medical equipment, but what we do specifically at Epic and Aviana and PSA is we provide the enteral nutrition, the diapers. You can also find from companies here locally like Travis Medical Supply, A&P Quality Care, and Medical Plus Supplies. They do what we call bent metal, wheelchairs, walkers, standers, everything like that. So as far as those, if you have any questions about the bigger stuff, I'd have to divert you to them, because I'm not educated on it, but I can help you with the diapers, the formula, and things like that. So with all of them, it has, in order for us to get stuff done, it has to come from a doctor. You can, if you need to do anything, you can. That's perfectly fine. I got ADD anyway, so I'm gonna be all over the place. So it all has to come from a physician or a nurse practitioner. We have to get a referral, an order from the doctor. So the qualifications for everything, as far as the diapers go, if you're going to get incontinence supplies, there have to be two things that happen. One, the patient has to be at least 4 years old, because the way Medicaid sees it, any child from birth up to age 4, there's a good chance that they're not gonna be continent, because they're babies, they're little kids, they're still in the potty training stages. Once they hit age 4, if we have another diagnosis, could be anything, developmental delay, all the way up to something more severe, cystic fibrosis, cerebral palsy, to where that will qualify them as well for the incontinence supplies. What that includes: diapers, and there are multiple kinds. You can get Pampers, there's Cuties, there's Prevail, all kinds of stuff for all ages. You can get bed liners, so if they're sleeping in their own bed, then you have that extra protector. Also might be called chucks as well. If you hear someone say chucks, that's the same thing. Just another layer in case they use the bathroom.
Do you guys do the reusable ones or only the disposable ones?
So ours are only disposable. That for me, the DME counts as disposable medical supplies, unless you're talking about a pump and the IV pole. We don't throw those away. Everything else we'll throw away, or is you're able to throw away. So everything as far as the diapers. A lot of times private insurance will not cover this. Medicaid does, however. Any form of Medicaid that you have can cover these supplies. Any company in the Austin area can try to get it covered. We will always submit to insurance if it's private insurance to try to get it covered. You never know. Sometimes it depends on the plan, but from what we've seen most of the time, it's not going to get covered just with private insurance. But if you have a Medicaid as a secondary or primary, we can use that for it. Second thing, stepping up a little bit, is the formula. All the companies that I know in Austin, you can get any kind, whether it's Nestle products, it could be Abbott, could be Gerber, any kind of formula that you guys want. Cake Farms is a big one these days. Nourish is another one, which are blenderized formulas if you're getting them through the G-tube. Anything all the way down to Pediasure, which is pretty simple. There are places, if the children are age 5 or under, you can go through WIC, which is perfectly fine. That's absolutely a resource that you can use. The only difference is with WIC, you have to go to see a nutritionist in order to get the order, and sometimes they might not supply as much as the child needs. What we've seen a lot are, especially with tube-fed patients, whether it's NG tube or G button, they might not get enough that's covered. There is a way to do it, and it's through companies like us, like URS, A&P, any disposable medical supply company. They can help you with that and cover the difference, or all of it if that's what you choose. The advantage of using someone that is a private company is that they can ship it to your house. And every 30 days, they'll send a shipment and it'll come directly to your house. You don't have to see a nutritionist. The doctor has to sign some paperwork every 6 months. Or if they change the order, maybe they increase the formula or increase the amount that they're taking, then we'll have to adjust that. And we'll
what about if the child is not tube-fed?
Not tube-fed. Great question. Excellent question. So you can still get it covered. So that's where the insurance. So Medicaid, everything that I talk about, Medicaid will cover, as long as you're within those guidelines. Private insurance, there is a way that you can get it covered, and I personally, in about the last 3 months, I've done about 5 to 7 appeals with families to make sure it gets covered. If it's just private insurance, they need to have, if it's a broken down, what we call hydrolyzed formula, amino acids are broken way down to help the stomach absorb it, private insurance has to cover it. It is a government law.
What if is it like Pediasure, but because of the dysphagia?
That can qualify.
It can.
Absolutely. So if it's private insurance,
That's private. We don't have Medicaid.
So private insurance, and actually, I'm glad you said that, because there is something else I want to talk about of families that can get Medicaid possibly. So private insurance, like I said, every company will try. If we get an order from whether it's GI or the pediatrician, we'll try to get it covered. We'll probably need what's called a letter of medical necessity. That's for the doctor to take care of. They'll write why they need this. Dysphagia is a great code that they can use, and it's what we call a billable code. That sometimes the insurance companies will initially say no, it's not. We're going to deny it. But then if we appeal it and we write a lengthier letter of medical necessity that I have a copy in my email at all times, because that's something that is very necessary.
So have you been able to do it with a kid without G-tube?
Yes.
Really?
Yeah, we've been able to get it covered before. It takes a little bit longer, instead of the normal 3 weeks to possibly a month that it usually takes. Sometimes it'll take a little bit longer, but we've been able to get it covered. Every company that I know, because I work with the other companies, we've got to work together to get every kid helped. I haven't seen one that they're like, we're not going to do that. It's not worth our time or whatever. We're all willing to work with you guys, work with the doctors to help you in whatever way possible. And that's a simple referral from the doctor's office to whatever company they prefer or you guys prefer. So it is a possibility.
It could be a primary care physician. Talking about the family physician.
Yes, it doesn't have to come from a GI. With the PCPs, primary care provider, sometimes they need a little bit more help. Most companies that provide the formula have a registered dietitian on staff. I think there might be 2 out of like the 7 or 8 in Austin that don't. So if it's a company that has a registered dietitian, usually that registered dietitian is far more than helpful to get you guys covered for that. They'll work with the doctor. They'll talk about the correct verbiage they need to use for the letter of medical necessity to make sure that you guys get all the help you can get. All right.
And I know you guys are new to town. I'm not wanting to spend a ton of time on this, but just a FYI. Anybody that's new to Texas, one of the first things you guys need to do, if you haven't already, is call and get on the interest list for Medicaid waivers. They waive the income so that she can get Medicaid as a secondary. It covers a ton of out-of-pocket expenses. It covers a lot of the stuff that he's talking about. That
thousands
It
and
would be
thousands
like
of
a
dollars.
secondary health insurance?
Right.
Oh, because I thought it was on, the Medicaid waiver was like for some services, but not like...
No,
Like health-
it's additional services in addition to the secondary insurance. It's
Absolutely.
a huge thing, but there's a wait list for all of them. So call if you haven't, get your name on all the lists, and yes, it's a huge benefit.
Yeah,
And a
they
lot of
spend
the stuff we're talking
thousands
about.
and thousands of dollars. I don't have any problem with it, and I'm not one of those guys who
Right,
just
you
want to
don't
abuse
complain
the
'cause it's your
system.
kid,
But I pay for
exactly.
it, but sometimes it's
We
so
only-
expensive we cannot do it anymore.
I know.
We only have
I know.
It's just
one private
ridiculous. It's
insurance.
so expensive.
Absolutely.
I know.
It does not cover
And that's-
it.
It is. It's expensive. It's crazy expensive.
And honestly, that's what these waiver programs are for.
Right.
Are for
Exactly.
parents that it's like you said, thousands of dollars. But there's a complication that most of the families that are on this Medicaid waiver list, they just want one therapy covered, so they're going to try to get on Medicaid. If your child is complex, more than I say at least 3 therapies plus other things. That's what Medicaid is for. It's
Right.
for you guys. It's not for the families that just want
Right.
a free ride.
Yeah.
No, I
it's,
guess
yeah. No, it's
so much money.
Yeah, I know. It's
Yeah.
it's crazy expensive, and getting on the waiver will help tremendously. Yeah,
Right.
absolutely. Call immediately
I
and
saw
get
that.
your name on there.
Yeah, thank you.
Yeah, and
Absolutely.
I'm not gonna
Oh, yeah.
spend a ton
No,
of
no,
time
no,
on
no,
that
of
because
course not,
that's a 10-day lecture.
I know.
At least.
But
Minimum.
I just want to be sure, since I know you guys are new to
Thank you.
town,
Yeah,
that you
thank
know
for
about
the
that.
information.
Absolutely. So the last thing that as far as the medical supplies that we provide, talk about the tube fed patients, G-tube, NG tube, GJ, which is gastrojejunal, NJ tube. There's all kinds of tubes, and so that one is a lot easier to get formula qualified because especially if they're what's called NPO, they're not able to eat by mouth. They have to have it through the tube, whether it's the button or through the nose. That's where insurances will cover it. However, there have been private insurances that I have worked with, and the GI clinic here has been great about helping these families out on private insurances not approving the tube-fed kiddos, and so we very crazy. And so we've done an appeals process to where they've actually gotten it approved later with letters of medical necessity and what's called a peer-to-peer, where the insurance medical director calls the doctor and they talk through it of here's why, things like that. That also comes with, for that, a lot of times it's out of the hospital that companies will get the referral for it, and everyone is set up, they're taught on the pump, whether it's an Infinity, whether it's a Joey, that's a whole other conversation for another day, on the different types of pumps and everything. And so that's usually set up in the hospital and then followed up by a gastroenterologist on that side. Any questions about any of what we've covered? Okay,
No, it's
and
pretty
feel
clear.
feel free to reach out to whoever. Anybody is more than willing to help. You guys take care of that. Stepping up a little bit is what we call the personal care attendant or personal care services, whatever you prefer. Personal care services is kind of what we consider the umbrella. A personal care attendant is the person that is in the home, and that is for what we've seen lately is any patient that has at least 2 therapies. Could be speech occupational, could be all 3 disciplines, especially more complex if you have cystic fibrosis, cerebral palsy, anything that has to do with daily activities of living. If there is something that is hindering that child from that, then some private insurances and definitely Medicaid will help out in getting an attendant for, could be 20 hours a week, could be 40 hours a week. We've seen higher, just depends on how complex the kiddo is. And now they are unskilled. It is not a nurse. It could be a CNA. What we've seen a lot that's been very helpful to families and very successful is a family member who is already probably helping out, whether if it's not the primary caregiver, whether it's grandma, grandpa, aunt, uncle, cousin, as long as they're 18 or older and they go through a training, every company requires a training for it, then they can become the care attendant, and then that person is reimbursed for taking care of them. which is a really cool thing to see when you go into the home or if they're coming out of the hospital. These families that you say, so was anybody taking care of them before? Yeah, my mom was. Oh, okay. Did she ever get paid for it? Well, no, she's my mom. We can help with that. It's not a lot. The reimbursement is not great, but if they were taking care of them, it's better than free. So we try to help out with that as much as possible. Companies will hire people for it, but because of the low reimbursement, the margins, at the end of the day, it is still a business, and some of these companies, it's hard to find someone because a lot of times Whataburger will pay more. So a lot of times these care attendants that aren't just family members, they're working with that company because they want to work for them. It's for the kids, for sure. So you don't really get bad care attendants because they really are there for the kids. And they do love working with them. And so same thing, that is a referral from the PCP, from a specialist if that's who sees it. I know Dr. Ravenscroft over at, can I say doctor's names?
Yes.
Okay. Sorry. That wasn't a guideline.
As long as you're not trashing a doctor.
No.
You can take it.
She's great. She's over the Especially for Children Developmental Clinic, and they see kiddos that have had developmental issues, and she's very on top of it as far as saying, hey, Mom, would you like some help? So they really want to help the kids, and they've done a great job with that as well. So it's a simple referral. What happens is if it's Medicaid, then the company will make sure that Medicaid is active, and then it's a quick process from a case manager with that insurance company coming out, taking a look, making sure that everything is accurate as far as, there is this developmental delay, there is this other diagnosis going on that's hindering them from normal activities of daily living, and then they'll provide the number of hours that they feel is necessary, whether it's 20, 40, 60, however many they think. You get weird numbers like 47. Which 47 is better than 40 at the end of the day. One question that might be asked about that is, if you have nursing services, which we'll get to in a second, can you also have a care attendant at the same time? The answer is yes. One is clinical, i.e. LVN RN. The other one is non-clinical. So whereas the nurse is there to help with the feeds, administering medication, anything clinical with that child, and they can help do the dishes for that child, the care attendant can help around the house, making sure that the house is more safe for the nurse and the child to be moving around. Because it is great for the nurse to help pick up, to make sure that he or she, whenever they have the baby or young child, is walking, that no one slips. But it's really tough when you're trying to watch the kiddo and clean up at the same time. So the care attendant's very helpful.
But usually in that scenario, you have a lot of hours for the nurse and very few hours for the PCS.
Right.
Yeah.
Right, absolutely. So normally what families will do is usually the nurse is able to take care during a certain number of hours, and then the care attendant is there maybe overnight to watch them, make sure that they're getting good sleep, or if you got one that was like me when I was a kid, waking up in the middle of the night running around the house, hey, let's get back to bed. Things like that, that's where they're helpful as well. So that's just a referral, verifying benefits if it's private insurance, making sure that is something that they will reimburse us for, and then with Medicaid, making sure they're eligible, getting the case manager out there to do it.
But private insurance, they cover both nurse and care attendants, or
they can. So the funny thing about private insurance, it all depends on the plan. You can have one family who is Blue Cross Blue Shield, and they'll cover this, and this, and another one who is also Blue Cross Blue Shield, and they only get two things covered because it's a difference in plan. So that's where the verification of benefits comes in. Every company has a specialist outside of the office, probably at their corporate office, who does that all day. They talk with insurance companies. God bless them for doing that, because I couldn't handle it. Talking with insurance all day is rough. So
I've done that, and it's horrible.
exactly, I imagine.
Horrible.
Right,
It is horrible.
I know enough about insurance to get me in trouble, and that's all I need to do. Don't want to get too much into it because someone else specializes in it, and I appreciate them very much. So the next thing I want to talk about is therapy. Now, if someone can name me, what is a discipline of therapy that you know of?
Occupational.
Physical. Perfect. And what's the last one?
Occupational.
Speech therapy. Perfect. So I've got
we got a winner.
a hot cold pack, a cup that changes colors to purple, or just a pen. Everybody can get a pen if you want.
Which one do you want?
These are hot sellers, so
Yeah.
I don't blame you.
And they're purple.
You can freeze them or put them in the microwave for 20 seconds, so it's great. Pull it back when you're playing softball or something like that. Good. So speech, occupational, physical therapy. Those are the main three that you see. They also have music therapy. There's ABA therapy for behavioral things. Some of which can and cannot be covered by insurance. That's that's any parent who's gone through all of those is like,
We've got a different Tuesday talk that's online for that too.
Perfect.
You can go back to.
Perfect. That's a great one.
Yes.
But the main three that insurances will work with, will approve billing codes for are physical, occupational, speech. So for those, just as an example, speech therapy covers two things actually, which I didn't know until I started working with Epic. I just thought it was speech, but they also do swallowing as well. So if there are any feeding issues where they're not creating the bolus to push the liquid back, if they're pushing it back and they're aspirating, getting it in their lungs, there are speech therapists to help with that. And so those are the two things you see. Articulation is what we call just speaking in general. And then feeding and swallowing is the other one. You might hear the word dysphasia. That means not able to swallow. The only reason I knew that, starting when I did 3 years ago, was because my sister-in-law is a speech pathologist. It's the only reason. So I know that one. So that is those are therapies that primary care provider can get you guys set up with, or it's also for a specialist. Gastrointestinal has a lot of the feeding kiddos that they'll need to refer out for the feeding issues. A lot of times, if there's a feeding issue, a lot of times formula is going to come with it, just because they're kind of one and the same. If there's an issue with swallowing, there's probably an issue with the texture, whether it's hamburger meat or bread or whatever. It's tough to swallow, and so Pediasure or any other kind of PO formula is what's going to come with that. Occupational therapy kind of does daily activities of living, writing. What our occupational therapists say, it's playing. They get to play with kids all day. That's what it is. Making sure that they're able to use their fine motor skills and things like that. Physical therapy is another one to where it's mobility. So it might be either they need to be stretched out, massages, which I would love. That'd be great. But also balance and things like that, making sure they're walking correctly and everything, their gait and things like that. So the way that works from referral to first treat or start of care, doctor sends a referral to a company. I'll give you guys two different examples because, as always, private insurance and Medicaid work differently.
Very different.
Private insurance, when we get it, it's got to be a verification of benefits again to see if that is a covered benefit. There are certain diagnosis codes with certain insurances that are not covered. Unfortunately, doctors can't make up diagnosis codes. If they don't exist, they don't exist. But they definitely look into every possible reason for kiddos to get the therapy because they need help. Private insurances, the general ones like developmental delay, speech delay, are very tough to get covered. There has to be, the more specific, the better. Mm-hmm. So I've gone into pediatrician clinics a lot and said, hey, do you have a more specific diagnosis than speech delay? What are they doing wrong? Was there an injury in the past to where they are not able to have where they're having the speech delay? Yes, they had a concussion or something like that. Okay, that can be a qualifier. We make sure that is a covered benefit, because the last thing that any company wants to do is say, yep, you're good to go, and then all of a sudden you get stuck with a bill that you weren't aware of. The other thing is, a lot of times it comes with a copay. We want to make sure that you guys know that what your copay is, because if we tell you one thing and it's something higher, not going to be too happy. If it's lower, you're good with it. Like, don't ask, don't tell. But if it's higher, you have every reason to be upset.
That's
So that
the first question I always ask.
absolutely,
What's the copay?
yep, absolutely. What's the copay? That is the best question to ask. Absolutely,
They add up. Yeah.
Absolutely.
They add up quickly.
So that can take up to 3 days depending on how fast insurance gets back to the company. Usually it's a 24-hour turnaround, but depending on the time of year, with school coming back and stuff, these kiddos are getting the physicals. They can get bogged down. Once that happens, once the benefits are verified or eligibility with Medicaid is checked and ran, if they are eligible with Medicaid, meaning active, then we can proceed to setting up what's called an initial valuation. And so there are some private insurances that don't require a verification to get an initial evaluation. Those are the ones we love. We love those plans because that cuts down the time to where we can call parents and say, hey, when can we schedule this? This is when our therapist is available. What about your schedule? So the initial evaluation is strictly where a therapist will come out. They will evaluate initially based on their tests that they have, and that is a great question for a clinical person if you want to know what tests they use, because my history degree doesn't qualify me for that one. But most therapists use the same type of test. That way it's all very relative to what from one company to another, and doctors can understand it. Once they perform the initial evaluation, they will write it up. That can take up to 2 days because the packets are about 5 to 7 pages thick, and they'll send it to the doctor and send it to the insurance. Insurance gets it just so it's on paper that this is what has been seen in the initial evaluation. However, the doctor's office has to sign it, and then we have to send it to the signed plan of, or called a plan of care. The initial evaluation has to be sent to insurance as well. That can take a week for them to review it and check it. That is with private insurance or Medicaid. Either way, someone is going to review it. They have a clinical person looking over it. This is why they think they need it. These are their goals that they want them to meet in the 3 or 6 month period, depending on what that insurance requires. There are different periods of how long the authorization is for. Once they say, yes, we think that would be good for the child, they will give us an authorization for 3 months, 6 months. Some can do 9 months or a year, but your typical range is 6 months. Once we get that authorization, then we're ready to schedule. So that can, yes, ready to schedule consistently in the home. Now, quick talk, but really the industry standard is about 50 days for all this to get done. Because once it's at the doctor's office, the doctor is going to have to sign it, and depending on the clinic you're at, there are a lot of patients that get seen. I know a lot of kiddos at I think the comprehensive clinic sees 600 kiddos. I mean, that's a lot of kids. So, that's a lot of signing for any of the providers there, and I think they do a great job with getting that stuff back, because 4 providers, 125 kids each, that's
That's where I'm at.
okay,
Dr.
yeah.
Burhani's great, but you see a lot we see a lot of kids, but she's great.
We work with Dr. Burhani a good bit. She's, all of them are good, the nurse practitioners and Dr. Rosenblum. So the industry standard is 50 days. Now, that does include Medicaid. Medicaid will take a little bit longer. Usually private insurance is a little bit shorter on the time frame that they will give. All depends on when things are processed. When the doctor signs, when your schedule is able to fit the therapist's schedule. If it's in-home, that's a tough one to do, because it might be after school, it might be daytime. Is the therapist going to be in that area? Because these therapists don't get paid a whole lot for mileage. So they want to make sure that they're not driving Pflugerville down to South Austin and back up to Round Rock. Make it worth their time. We like to put them in clusters so they can make sure that they get the family's taken care of as fast as possible. So about 50 days is what you're looking at. It can always happen sooner, but definitely I'd like to tell the families it's going to be at least a month, just because of insurance requirements. Any questions about the therapies?
So if you're in a PPCD program, if you're in a daycare, they can actually go to the daycare centers.
Great point.
They can go to,
Besides the therapy that they're already receiving there?
No, they don't usually go to school. If it's a public school,
Correct.
They will want you to use the school services,
Sure.
which have completely different goals.
Right.
But if you're in a daycare that's not actually a school, it's just a daycare,
Right.
they will go to the
They will
daycare
go to the
centers.
daycare, right?
Yes, great point. So independent school districts, public schools, they don't allow it because they have their own programs. That's another conversation. We're not supposed
Right,
to say
that's-
anything.
yeah,
That's
that's a whole
that's a
different
conversation
conversation.
we
Right.
can have. You can have with other families. You can have with me. There are things that go on there that, you know. But you can also get the therapies in addition to it, the private therapies.
Yeah.
So if they do go to school all day, you can still get them after school as well. A lot of doctors recommend it, just because a lot of times you're going to get seen your child's going to get seen once a week at the school, and a lot of times it's group settings. So that's a little bit tough, to see any improvement and any extra that is allowed by insurance.
Well, and
you take
summers
it.
and holidays and all that stuff as
Yep.
well. You're gonna, you don't always want to have a lapse during summer break, and so
Right.
having the third party to pick up the slack when there is no school is kind of a big deal as well.
It's a big deal, of course.
And there are always families that they're like, yeah, it's in school therapy is fine. When summer comes around, we'll pick this company up and get it 2-3 times a week in the home or in the clinic. That's absolutely acceptable. And then when school starts back, they're discharged from that company and they go back to school.
And do the school therapists, they bill your insurance company?
It's
No, there's gray area there.
to make it easy, no. But technically, yes, they are billing, but there's no copay on your
Right.
part.
But the insurance company, they have a maximum for
Right.
therapy, so
And
they're-
so
they're
you don't
spending.
have to sign the paper at the school that allows them to send it to your insurance. You can deny signing that, and they will still give your child the services in the school, but they won't be able to bill you because you didn't sign that paper. So I always tell people, don't sign the paper.
Don't sign.
Yeah. It's really,
Because-
probably shouldn't say this on camera.
I don't know what you're talking about.
To notice because I
yes.
have a maximum and
Exactly.
then they're gonna finish at school and I could not receive services at
Right,
home.
exactly. And especially when you're not able to get services year round, because once you turn 3, you go into the school system that's not year round. And so, yes, I typically tell people, and I'm not you, I'm not seeing
Doesn't-
people like professionally.
doesn't bother me.
Just as another mom, I tell people when they ask you to sign the paper to bill your insurance, just say no.
Speaking of the maximum visits, if you get a letter of medical necessity from the doctor, that company can submit it to insurance and get an extension.
Extension, yeah.
And you can get
but
more.
They told me that sometimes get difficult because they want to see the progress notes.
Right, and it's all these different therapists and overlap, and they have different goals. The
Right.
goals in the school and the goals out of school are very different. So, were you about to say something?
So, do you recommend not signing off the Medicaid number to the school?
I never would with Casey. I always said no, just because there were so many things that we really had to get done, whether it was nursing or therapy or whatnot, separate of school, that I didn't want it to cloud. You know, if everybody's billing from different things, I didn't want it to cloud our bucket of hours, and I couldn't take that risk, and so I didn't sign off on any of it.
I need word they receive the service.
Oh yeah, they still receive the services, and I think schools are used to it because, there's lots of parents that just, no, I don't want to sign off on that, and they still give your kids the services. Yeah.
So, and especially with Medicaid too, they can say, well, you're already being, they can pull the card of, hey, this, even though the school isn't an actual company, they're still being seen by another therapist. You can't double dip.
And they'll deny services, and so yeah, if you just tell them in your IEP meeting when they ask you to sign
I
that.
can't remember if I did. I remember I can have the visual in my head.
Yeah. And if you signed it, it's not always a
Probably
huge
always
deal.
revoke it.
You can always revoke it. Exactly. It just at your next IEP meeting, if they ask you to sign it again, just say, I don't want to do that. There's a potential that I could lose hours, I could lose services.
Okay.
I'm going to decline.
Okay, that's good.
Yeah. It's,
Excellent question.
Yeah. It's a tricky thing. The schools are.
Insurance.
They
in general.
really do
God bless
care.
it.
The people in the schools want the best for your kids, but their hands are tied because of financial things, and it's all about money.
That's what we're always talking
It's all about
about.
money.
It's
Everything
all
is about
about
money.
Unfortunately.
All over the world, not just here. It's all about money.
So the last thing that I want to bring up is what's called private duty nursing. A lot of people think that it's private pay, and it is not. Could be, but for most people, it's not. Companies will run through the insurance. With private insurance, let me back up. Qualifications. That's the best place to start. Now, there are some insurances, private insurances, that if there are enough diagnoses that make it very tough, lots of seizures, maybe continuous oxygen, even no feeding tube, there have been patients that have gotten qualified for it. It's always an option. You can always check and see. What private insurances do is they base their authorization on medical necessity. Is it necessary for a nurse to be out there? I.e., how much money are we going to spend on a nurse compared to if they go in the hospital a lot? That's the bottom line, is how much money are we spending, because that's what insurance is always thinking about. So if there are multiple hospitalizations, unplanned, if it's surgeries, that's planned, unplanned hospitalizations for whatever, they might say, yeah, we'll help out 40 hours a week in school or something like that, because in school they can get sick easier, maybe stuff has happened at school to where they've had to go to the emergency room, who knows. Your main qualifications that will approve you for private duty nursing, minimal is some kind of feeding tube, either G button, less the NG tube, because NG tubes are seen as not permanent. Or, excuse me, let me rephrase it, not long term. Because G buttons we always feel are never permanent. Because that's what speech therapy is for. At some point, I feel the speech therapist is going to do a great job and get them to graduate from the button. Doesn't always happen, but it is far more long term than an NG tube. Just as an example, NG tubes are about maximum 6 months. If there hasn't been enough progress in 6 months, a lot of times the doctors will say to keep from skin breakdown, either in the nose, going down the esophagus, they'll say let's put a G button there. That way it's just safer for their skin integrity. Plus, if they're playing with the NG tube a lot, having to drop it again, it can be a hassle. So the G tubes are one of the minimum qualifications. Also the tracheostomies, and then ventilator dependency as well. So those are kind of the main four you're gonna see. Any kind of nasogastric tube or NJ nasojejunum, or the G button and tracheostomy ventilator dependency. Those will get you the qualifications where insurance will very seriously consider it. Any extra diagnoses that a child has, that will just qualify for more hours. So if it's G button with 3 or 4 medications, you're looking at 40 hours, give or take. I've been in the industry 3 years, so it's always up to the nursing director to decide. There are things that I do not see because I am not clinical, but I can always give parents an idea. If there's seizures, that's going to increase the potential for hours. Any other diagnoses, cerebral palsy, cystic fibrosis, spina bifida, anything extra will increase hours. A lot of times what you see are babies that are out of the NICU that are tracheostomy ventilator dependent with a G button is 168 hours, which is 24 hours a day, 7 days a week. Now that's what's authorized, just so everyone knows.
That doesn't mean insurance will pay it.
Correct. Well, if insurance authorizes it.
Okay, I thought you meant that's what the doctor ordered.
Right, and same thing. Doctors can order whatever they want, but insurance can look at it and go, we're not going to. The insurance has the option to say yes, no, or no, but we'll give you this many hours. So if, for instance, a child has had a G tube for 5 years, and they've never had nursing before, but now they want it in the school, you might ask for 40 hours a week, but the insurance says, well, there haven't been a whole lot of hospitalizations, they're pretty healthy, there's an 8 at the school, we'll give you 20 or 30 hours. Yeah, absolutely. So it's always up to insurance. Go ahead.
My question is, if the child does not qualify for the nursing, then I can try for the care attendant, right?
You nailed it.
Those are the two options?
Mm-hmm.
Care attendant and nurse?
Correct.
Okay.
Correct.
But you say something like the care attendant is they're not available.
They're not skilled.
They're not skilled.
They're not skilled.
So they didn't go to nursing school.
And they're not paid as much. And since they're not paid as much, it's harder to find people that want to do that job.
So it's more easy to find nurses than care attendants.
Correct.
But if the child
Well,
does not
that's
qualify-
not totally correct either, because nurses are, so the agencies will have more nurses than attendants. So when you go through an agency, that's technically true.
But you have to pay them more.
Well, they have to pay them more, but then there's also finding the nurse that's available for the hours that you need.
Correct.
And that's sometimes a challenge as
Because
well.
if the child does not qualify because of doesn't have the minimum, like the
Exactly,
G2,
because you take care of the child, so she's not gonna need, she's not gonna be needing a G-tube.
So,
That's
Right.
what's happening with our daughter, you know.
Right.
Yeah.
But so in our case, for example,
Yeah.
if we try to get a attendant,
hmm
that will be more difficult because less availability of.
It's just less people want to do it because it's paid. It's
Right.
a low paying
But
job.
anyhow,
Yeah.
I can ask the physicians for the referral.
Sure.
And you can ask the physicians to write a letter of medical necessity for a nurse. You know, even though she doesn't have a G-tube, if there's enough other diagnosis and medications and risk and all of those other things, they can try. I mean,
Sure.
it never hurts to try.
The physician, if the physician wants to try first the attendant, the referral has to say attendant, not nurse.
Correct. So so it would be like referral for attendant care, and they could put a number of hours per week if they want to try 50 attendant care for 50 hours a week.
Okay, so the physician has to specify if it's
Mhm.
nurse or.
Correct.
Or attendant. Yeah.
So
Yeah.
we'll talk in the next visit.
Exactly, that's very important.
Mhm.
Yeah.
The point
Absolutely.
is that sometimes you take good care of your
And then
baby.
you get penalized
And
for
then
it.
you get-
Yes,
exactly,
you
but
do.
Seizures are under control. That's good.
Right. Under
That's
control.
bad because.
Exactly, it's too bad
She
because
does
you
not
cannot get an
qualify.
exactly. She doesn't
Yeah.
qualify.
Right.
Because this baby takes us basically 3-4 hours a day to feed her. I mean, her mom is doing that.
Because she doesn't have a G-tube.
She
Right.
doesn't have a G-tube, and then she's in a good weight.
But
because
I don't want to put a G-tube just to
No.
get a nurse.
Exactly.
Yeah.
No,
I know.
Right.
we
It's,
don't want that.
I know. It's
But-
a.
But it would not be bad to have an attendant that
Right.
at
Exactly.
least I could go take a shower and eat because
Exactly.
sometimes I cannot even.
You need
do
24/7.
that.
Right.
24/7, you know.
Yeah, it's.
Service.
But I can talk to the Dr. Berhani
Mhm.
and see if she can write
She-
a referral for
And
an
she
attendant.
absolutely will. They have a lot of kiddos that have attendant care.
Mhm.
Okay, I
They
just
have a
started.
lot.
I just only had one appointment with her.
Yeah,
we haven't
no.
talked about all
Right.
the services, but now that I know, in
Yeah.
my next appointment, I will ask her about the attendant.
Mhm.
Absolutely. Absolutely.
Because I know that for the nurse it's going to be a little bit more difficult since she doesn't.
Exactly, because
And
she's
I don't want to try
taken
something
care of.
that I know they're going to say no. You know?
Right.
Yeah,
So I
it's
was trying-
yeah, I know. It's hard. It's hard to get help, but then once you get help, it's like, oh my gosh, why did I wait so long? I should have called and gotten help 2 years ago.
The only
Yeah.
problem is you don't know what you don't know.
I know.
And that's which is great for things like this. Thank goodness.
That's what we do this for. Exactly.
Absolutely.
Let's make sure everybody knows what's out there.
So insurance can approve, deny, and then have less hours. Now, what some families think is that, I'm approved for 120 hours a week, we're going to get staffed that. Not always the case. Unfortunately, coming from a company that does that, any parent that asks me, so I'll get a nurse there 120 hours a week, I'll get a nurse there 40 hours a week, can't promise it. Because unfortunately, we don't have any robot nurses. Nurses do get sick. Nurses do have kids that get sick. They move. They decide that they're gonna go to either a different company or the hospital, which I can't blame them, because the hospitals offer more money. So just because a family is authorized for that many hours doesn't mean that I would ever guarantee that that's how many hours they're going to be staffed each week. That is one of the reasons that at the hospital, whenever a kiddo gets either a G-tube, they're tracheostomy ventilator dependent, the parents do the room in. Either a 1 or 2 night room in, depending on all the equipment that goes with it, because at some point, parent is going to be in charge. And any case manager that says, yeah, you're not going to have to worry about it, that's not true. They're pulling your leg. So unfortunately, it's not a perfect system as far as, nurses have every right to call out and say, hey, I slept in, I'm just not going to come in. They can say, I got a flat tire, I got to get my car fixed, whatever it might be. Companies do work as hard as they can to staff that family. They are going to make a call to every nurse on their roster, but not all nurses are ready to go.
Well, and for us specifically, like when we had Casey, if a nurse called out, we didn't want somebody off the roster because it took weeks to learn how to take care of Casey. And so we didn't want just any nurse to come fill in. Because it's like, well, no, that nurse is going to be more trouble than me taking care of Casey by myself. And so sometimes that's a great solution. Sometimes for some families it's not.
I mean, it's every kind of family. I've seen it both ways. Hey, get me somebody. I've got
to go to work. I got to get somebody here.
Right.
Some people there's not an option.
And then sometimes it's some good things.
Yeah.
Absolutely.
I will just do this myself.
Yep.
Don't send me anybody.
Absolutely.
Yeah.
I better do it.
So it is nice to have the help when you can, but don't I just always prepare families. Don't expect that to happen at all times because people are human.
Exactly. Don't get too spoiled.
Right.
Well, and if you have something like some big event coming up, like we had a wedding that we wanted to go to at one point. And so we had a nurse that was on the schedule for Casey, and we had another nurse that was back up in case that nurse called out because it was like we had to travel for this wedding. We had another nurse in case that nurse called out. All three of them dropped the ball.
No.
We didn't go. But I mean, it happens, and we made sure we had 3 levels back, and it didn't work. So yeah, when it's a big thing, you line them up and you do all you can. But
for example, we don't have family here. We can only the 3 of us, so I cannot call somebody to come, my sister or my mom.
Exactly.
Yeah, it's hard. It's very hard, but that's part of when that's part of this life. You know that I'm going to cancel a whole lot of things, and all your friends and family just deal with it.
Gladly, we don't have any problem with that because it's a different kind of love, and we love our babies. So, but it's good to have a little bit of help once in a while.
Absolutely.
Considering that you're spending thousands and thousands of dollars for something that's not even worth $200, because it's all about business. We just talked about it.
Yep, and so that actually brings me to my last thing I want to talk about. It's actually not related to any of those services in a roundabout way. I mean, I guess it is. So that's the Medicaid waivers. So there's always the options. You can get on the wait list. You can do the buy-in. The one that I've do what?
I always forget about the buy-in.
Oh yeah. So where you pay a little bit to have Medicaid, things like that. There is a copay and stuff. That's another, that's a whole conversation offline that you could have with somebody. But one that I've come across. So when I first started with Epic, I worked in North Houston in the Spring Woodlands Conroe area, very affluent neighborhoods, and it was a lot of private insurance for these kiddos that had feeding tubes, seizures, cerebral palsy, things like that. There is a waiver called the Rider 28.
Money follows the person now.
Yeah, well, yeah, / money follows the person.
They changed the name.
And so, and it gives you a list of 6 diagnoses, or 7 now because hospice is on there too, of ways you can get it. The few of them. One is hospice, 24-hour oxygen. Seizure activity, consistent seizure activities daily can be. It doesn't have to be daily. I've seen it to where they kind of go, okay. But seizure activity, feeding tube, tracheostomy, ventilator status, there's more. Renal failure, and also autoimmune deficiency. So if any of those, what are we at? 8 now? 9? Math is not my favorite. 8 or 9 qualifications that you can apply to that. That has been used multiple times by myself to get these families help.
You don't have to wait in the line. So the 5-year wait list, right now they call it money follows the person.
Yeah.
And it's only for MDCP. It's not for all the waivers. It's only for medically dependent child care program. But that's the one most people start with is the MDCP program.
And so what it is really the Medicaid, the actual wait list is about 10 years, depending on, before you get too scared, depending on the complications, you can be bumped up in front of other people.
Right.
Like I said, people are on there because their child is getting speech therapy for a speech delay. More important, higher up the list. But the longest I've seen the Rider 28 money follows the person take is 3 months.
Yeah, it's very fast.
And so you get on that.
28. Yeah.
And I've got some in my car. I can bring it to you.
Cool.
And it's unfortunately it's parent driven. So you guys have to stay on top of it,
Right.
which shouldn't be a problem.
No,
You know, I mean, most of the
we do it
families are
gladly.
like, duh. But that's just saying, you know, your therapy company can't call, your DME company can't call and do it. It has to be done by you guys. And all that is they'll do like a pre-screening over the phone where a case manager will talk to you and ask questions, make sure that your child could qualify for it. Then they'll set up a day, a week or two later maybe, to come out and see them. Could be longer than that, just depends on their availability. And then whenever they come out and see your child, then they'll set up a date to where your child will stay in a nursing facility overnight.
You stay with them.
You stay with them.
Before
Yep.
you freak out, you stay with
You
the
stay with
child.
them, and it's not really overnight. It's like check in at 9-10 o'clock. You get discharged at 5-6 o'clock the next day. So
Morning,
9-10 o'clock p.m.
Okay.
You get discharged early the next morning. But as far as they're concerned, it's October 17th to October 18th. That's all they see.
And technically, it's supposed to be 30 days, but a doctor will write a letter saying
Right.
that for your child's needs, 30 days doesn't really make sense. 24 hours makes more sense. And so they'll write it for a 24-hour period. You'll check in, you'll check out. And when you leave, you have Medicaid as your secondary insurance and you are on the waiver.
Yep.
Are you guys on the waiver? Yeah.
Yeah.
Yeah, we did it the back door this way too.
Out at like 12:05.
Yeah.
Oh, that's even better.
Yeah. Well, I've heard people now, they're there for like an hour. And I'm like, man, they made us stay for like 10 hours.
Oh, really?
But that was a long time ago.
A long time ago, they used to do it in the hospital. They'd discharge them for a day, go stay in there, and readmit them.
I wish
They
it was the
can't-
hospital.
They can't do that anymore.
Yeah, no, we had to go to Copper's Cove. Did you guys do Copper's Cove?
Temple.
Temple?
Okay.
Oh, but they didn't have Temple when we went. Otherwise, I would have done that.
Yeah.
Yeah, we do.
Wasn't too far away.
Okay. But yeah, it's not a fun night, but it's totally worth it.
Yeah. I do it.
Totally worth it.
So does anybody have any questions? I have 2 questions. What is one of the services that we talked about tonight?
Nursing.
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 Would you like private duty nursing? Would you like a cup? Would you like a
I'll do the gel pack.
hot cold pack?
Those are a hot seller.
What is and what is one of the services that we provide or that is provided? Sorry, forgot.
The therapies,
Therapies. Cup or hot cold pack?
the cup.
The cup.
Thank you so much for doing this.
Absolutely.
This is
Thanks for having me.
fantastic information, and hopefully
Thank
everybody.
you. It was very helpful.
What areas do you cover in Austin?
So me personally,
In the company.
oh, so we cover Georgetown down to San Marcos, and then like Marble Falls over to Bastrop, Elgin area up that way.
Big area. Yeah.
We are near here, so I don't know. Like for example, Dripping Springs. That
Mhm.
part is covered too.
Yes, ma'am.
Okay.
Yep. Absolutely. And there's lots of companies that will cover all areas. I mean, it's, you know, when you see, you know, if you have any questions about any companies, talk to Dr. Burhani. Comprehensive Clinic is very well connected with the special needs community. They can probably tell you, I mean, their social work team is great. They can tell you about a lot of stuff going on, whether it's events or, you know, specific services for your kids. And the great thing now that I'm thinking about the Comprehensive Clinic, they have their own dietitian, and you could ask Dr. Burhani and say, hey, is there a way we could get a letter of medical necessity written by the dietitian, signed by Dr. Burhani?
Exactly. I have my first appointment with the dietitian this Friday.
Perfect.
So
Her name's Alyssa. She's great. She came from Dell.
So I will talk to her about the medical necessity for the formula.
Sure.
Because right now we're paying out of our pockets all the Pediasure.
Yep.
And it's getting quite
No, we don't want
expensive.
to abuse the system. I
It's
mean,
not-
it's
I
not
pay,
abuse.
I
It's
pay,
because
but the
they
point is
You're-
that sometimes
you're
you pay
not
so much
abusing
money
it.
you
Yeah.
cannot pay anymore.
Yep.
It's
You're
so
not-
expensive.
Yeah,
You're
and
not-
the
you're not
waivers
using
are
the
set up
system. Yeah.
for families just like yours and mine was the
Exactly.
same way, where we have so much out of pocket every
Exactly.
month. You
Because
can't-
you know it's
you
about
can't
business.
sustain
I
that.
don't want other people to pay for my daughter.
No,
I don't
no,
feel
no,
like that,
no.
and I don't like that.
No.
But I know that on the other hand, I realize that unfortunately, medicine is it's a lot about business too.
Right.
You know, you're spending so much money, and sometimes it's just impossible. You cannot
Right.
do it anymore.
No, it's not
Just
sustainable.
be gentle, don't cry.
You make a
He's
new
my
friend.
little buddy. He's my little buddy. Yeah.
All right, well,
He's my
I'll
little
actually go
buddy.
get that
Thank you
form
so
for
much.
guys.
I really
Absolutely.
appreciate
Absolutely.
everything.
Thanks for
I have
having
a
me.
couple questions.
Yes.